Welcome to our journey to the fascinating world of pediatric dentistry. Hi, my name is Andrea Tumangil and we will be discussing to you about pediatric dentistry. Did you know that dental caries, commonly known as cavities, is the most prevalent chronic disease in children? Surprisingly, it's 5 times more common than asthma. Today, we will delve into the world of pediatric dentistry, define its scope, explore its historical evolution, and highlight the crucial role of pediatric dentists in safeguarding children's oral health. Pediatric dentistry, a branch of dentistry that caters exclusively to the oral health of children, from infancy to adolescence. This field faces unique challenges and plays a crucial role in ensuring the well-being of their patients. Importance of pediatric dentistry. Pediatric dentistry is not just about kids' smiles. It's about their overall well-being. Dental issues can cause pain, infections, and even hinder their growth and development. Let us now talk about the history of pediatric dentistry, the birth and the growth. In 1909, Minnie Evangeline Jordan opened the first ever pediatric dental practice in the US, focusing entirely on children's oral health. Jordan's groundbreaking research, lectures, and publications highlighted the significance of pediatric dentistry, earning her the title of a pioneer in pedodontics. 1940s, official recognition and growth. Thanks to the dedication of Jordan and her peers, the American Dental Association, ADA, officially recognized pediatric dentistry as a specialized dental field. This recognition brought children's dental care into the spotlight, leading to a 50% increase in children visiting dentists annually. The Pediatric Dentistry Training Program was established to train more dentists in specialized child care. Late 1990s, a focus on children's oral health. In the late 1990s, the U.S. Secretary of Health and Human Services emphasized the importance of children's oral health and its impact on their overall well-being. The ADA developed best practices, products, and techniques tailored to children's dental health, officially recommending that children have their first dental checkup by their first birthday, 1910s to 1930s. Early developments. Early pioneers opened kids-only dental practices, even with limited formal education on children's dental care. Minnie Evangeline Jordan's publication shed light on the unique dental needs of children. Alfred C. Phones introduced a program involving recent dental school graduates providing care in public schools. 1960s to 1980s, advancements and specialization. The Pediatric Dentistry Training Program was established to increase the number of dentists capable of meeting the unique dental needs of children. Dental sealants were developed to prevent cavities in children's back teeth. The first National Health and Nutrition Examination Survey emphasized the importance of oral health in overall well-being. Roles of pediatric dentistry. Pediatric dentists wear many hats, including preventive care, early intervention, education, behavioral guidance, specialized care, orthodontic evaluation, emergency care, special needs care, preventive measures, community outreach, and parent and caregiver education. They also established a dental home for children. The pediatric dentist expertise. Pediatric dentists undergo extensive training, including an additional 2 to 3 years beyond dental school. They specialize in child psychology, behavior management, and various pediatric dental treatments. Their expertise allows them to create a comfortable and safe environment for children, reducing dental anxiety and ensuring a positive dental experience.
Challenges in pediatric dentistry. Treating children poses challenges, like managing dental issues, like cavities and dental trauma, behavioral problems, developmental disorders, and special needs. These difficulties arise due to the child's developmental stage and ability to cooperate during dental care in a traditional setting. Common dental issues in children. Tooth decay or cavities. Tooth decay is one of the most common dental problems in children. It occurs when bacteria in the mouth produce acids that erode the tooth enamel, leading to cavities. These can result from poor oral hygiene, frequent snacking, and sugary drinks. Malocclusion or bad bite. Malocclusion refers to the misaligned teeth or an incorrect relationship between the teeth of the upper and lower dental arches. This can lead to difficulties in chewing, speaking, and maintaining proper oral hygiene. Early detection or orthodontic intervention can help address malocclusion effectively. Thumb sucking and pacifier use. Thumb sucking or pacifier use can lead to dental problems such as misaligned teeth and changes in the shape of the roof of the mouth. Pediatric dentists often provide guidance to parents on how to break these habits gently. Dental anxiety. Fear of the dentist is common among children. Pediatric dentists are trained to create a comfortable and friendly environment, easing children's fears and making dental visits a positive experience. Tongue thrusting. Tongue thrusting refers to a habit where a child pushes their tongue against their teeth, especially during swallowing. This continuous pressure can affect the alignment of teeth, leading to malocclusion or incorrect bite. Premature tooth loss. Premature tooth loss in children occurs when a baby tooth is lost earlier than it should naturally fall out. This can happen due to accidents, decay, or other dental issues. Gingivitis and gum disease. Gingivitis is the inflammation of the gums and is often caused by the accumulation of plaque. If left untreated, it can progress to gum disease, which can cause gum recession and even tooth loss. Teaching children proper brushing and flossing techniques is crucial in preventing gum issues. Behavioral challenges can pose significant obstacles for pediatric dentists when treating young patients. Children, especially those who are anxious, uncooperative, or have special needs, may find dental visits stressful. Pediatric dentists are trained to handle these challenges with patience, understanding, and specialist techniques. Here's how pediatric dentists manage young patients with behavioral challenges. Establishing trust. Pediatric dentists focus on building a trust relationship with young patients. They use friendly, non-threatening language to create a comfortable environment. Establishing trust helps alleviate fear and anxiety. Behavior guidance techniques. Pediatric dentists are skilled in various behavior guidance techniques. These include positive reinforcement, distraction, and desensitization, where the child is gradually exposed to dental tools and procedures in a non-threatening manner. Dentists use praise and rewards to reinforce good behavior, making the dental visit a positive experience. Child-friendly environment. Pediatric dental offices are designed to be child-friendly and welcoming. Bright colors, toys, and engaging decorations create a positive atmosphere. Waiting areas often have toys and books to keep children occupied, reducing anxiety before the appointment. Sedation and anesthesia. In cases of extreme anxiety or extensive dental work, pediatric dentists may use sedation or general anesthesia. This ensures the child is calm and comfortable during the procedure. Dentists carefully assess the child's health and tailor the sedation method to each individual case, ensuring safety. Parental involvement. Pediatric dentists encourage parents to be present during the child's dental visits, providing comfort and reassurance. They educate parents about proper oral hygiene and techniques to manage children's dental care at home. Communication. Effective communication is key. Pediatric dentists explain procedures in a simple, age-appropriate manner, ensuring the child understands what will happen during the appointment. They listen to the child's concerns and address questions patiently, reducing anxiety and fear. Technological advancement. Digital radiography. Digital x-rays have replaced traditional film x-rays in many pediatric dental practices. They emit significant less radiation, provide instant images, and can be enhanced digitally for better diagnostics. This technology ensures quicker and more accurate assessments, reducing child's exposure to radiation. Laser dentistry. Lasers are increasingly used in pediatric dentistry for various procedures. They are minimally invasive and cause less discomfort, making them ideal for children. Lasers can be used for cavity detection, soft tissue procedures, and even dental fillings, often without the need for anesthesia. Laser dentistry is the use of lasers to treat a number of different dental conditions. The instrument creates light energy in a very narrow and focused beam. This laser light produces a reaction when it hits tissue, allowing it to remove or reshape the tissue. Laser dentistry is used in a variety of procedures, including treating hypersensitivity, treating tooth decay, treating gum disease, and whitening teeth. Teledentistry. Teledentistry allows pediatric dentists to consult with patients and parents remotely. This technology enables virtual appointments, consultations, and follow-ups, enhancing access to dental care, especially in remote or underserved areas. Sedation monitoring. Advanced monitoring systems have been developed to ensure the safety of children under sedation or anesthesia during dental procedures. These systems continuously monitor vital signs, providing real-time data to dental professionals, ensuring the child's well-being throughout the process. Caries detection devices. Innovative devices such as Fluorescence-based cameras help dentists detect cavities in their early stages. Early detection allows for minimally invasive treatments, preserving more of the natural tooth structure and reducing the need for extensive procedures. Pediatric dental visits. A pediatric dental visit is a child-focused appointment, emphasizing prevention and education. The child's teeth are checked and cleaned, and fluoride treatment may be applied. Positive reinforcement is used, and parents receive personalized oral care guidance. The visit aims to instill good dental habits early while ensuring a positive and efficient experience. First dental visit. The first dental visit is recommended by 12 months of age, or within 6 months of the first tooth coming in. The first visit often lasts 30 to 45 minutes. Depending on your child's age, the visit may include a full exam of the teeth, jaws, bite, gums, and oral tissues to check growth and development. Child-friendly dentist. Child-friendly dentist is a dental professional that offers services especially for children. They may also treat teenagers and adult patients as well, but they take extra steps to ensure they have the tools, resources, staff, and office necessary to adequately treat younger patients. They typically have a staff that understands how to communicate well with children and have a more inviting office, which may include colorful walls, a play area, and many more. Here are some effective techniques and strategies for achieving a child-friendly dental environment. Cheerful and playful atmosphere. Design the dental office with bright colors, playful themes, and child-friendly decor. Use colorful walls, fun artwork, and vibrant furniture to create a welcoming and engaging environment. Kid-sized furniture and amenities. Provide child-sized chairs, sinks, and dental equipment to make children feel comfortable and at ease. Small familiar settings help reduce anxiety during treatments. Friendly and patient staff. Train dental staff to be patient, compassionate, and understanding when dealing with children. A friendly demeanor and a warm smile can go a long way in making children feel safe and secure. Interactive waiting area. Create a waiting area with toys, books, and interactive games to keep children entertained while they wait. Engaging in activities can help distract them and ease any nervousness. Clear and simple communication. Use age-appropriate language to explain dental procedures. Dentists and hygienists should communicate clearly, addressing children's concerns and questions in a reassuring manner. Positive reinforcement. Employ positive reinforcement techniques such as praise, stickers, or small rewards after dental visits. Positive feedback help create a positive association with dental care. Now let's talk about preventive measures. Preventive measures are paramount in pediatric dentistry to ensure optimal oral health from a young age. These measures help avoid dental issues and instill good habits. Here are some key preventive measures. Regular checkups. Schedule routine dental visits for children from an early age to monitor oral development and detect issues early. Oral hygiene education. Teach children proper brushing and flossing techniques, emphasizing the importance of daily oral care. Fluoride treatments. Apply fluoride to strengthen tooth enamel and make it more resistant to decay. Dental sealants. Use sealants on the chewing surfaces of molars to protect against cavities. Dietary guidance. Provide guidance on a balanced diet and limit sugary snacks and beverages to prevent tooth decay. Orthodontic assessments. Evaluate and monitor the child's bite and teeth alignment for early orthodontic intervention if necessary. Thumb sucking and pacifier advice. Offer strategies to help children break these habits to prevent bite and speech problems. Mouth guards. Recommend custom mouth guards for young athletes to protect their teeth during sports activities. Counseling on bottle feeding. Advise parents on the importance of not letting children fall asleep with a bottle to prevent early childhood caries. Dental education for parents. Educate parents on their role in oral hygiene, diet, and regular dental visits for their children. Preventive dental products. Promote the use of products like sugar-free gum and mouthwash with fluoride for added protection. Severe early childhood caries management. Identify and address severe early childhood caries promptly to prevent complications and further dental problems.
So let us now proceed with the common pediatric dental treatments. The first one we have is dental prophylaxis. Pediatric dental prophylaxis, also known as dental cleaning, is a procedure performed by pediatric dentists to maintain the oral health of the child. The next one we have is cavity fillings. Pediatric dentists treat caries by removing the decayed portion of the tooth/teeth and filling it with a suitable material. The next one we have is dental bonding. a quick, easy procedure to fix crooked, chipped, or discolored teeth by sculpting a composite resin directly onto the tooth. The next treatment we have is dental crowns. When a tooth is damaged but not to the extent that it requires extraction, crowns may be used to restore its structure and function. They're designed to naturally come out when the deciduous teeth exfoliate to make way for the eruption of permanent teeth. Next one we have is pediatric pulp therapy, also known as a non-vital pulp therapy. It is used to treat, save, and restore a child's decayed deciduous teeth. Now there are two types of pediatric pulp therapy: pulpotomy and pulpectomy. A pulpotomy is performed when the decay or damage is only up to the pulp's tip, while a pulpectomy is applied to the damaged root canals and the crown. Now the goal of pulp therapy is to preserve the infected tooth and avoid extraction. Now in cases where a tooth is severely decayed or damaged, pediatric dentists may perform extractions to prevent infection and other oral/systemic complications. Now, an orthodontic procedure a pediatric dentist can perform is space maintainers. It keeps space open to allow the permanent tooth to erupt and come into place. Now, in some cases, a delay in care may result in the loss of a tooth that could have been saved. Most pediatric dentists encourage patients to call if they have a dental emergency. Depending on the situation, the staff may provide instructions and direct them to come in for an appointment, or they may advise them to seek immediate specialized care elsewhere. So let us now proceed with parental involvement. Parental presence/absence during treatment. Various philosophies exist regarding parental presence, with some practitioners and parents preferring parental presence for child comfort, while others believe it may cause distraction. Now, studies involving parental presence/absence during treatment. Example studies include but not limited to: in one study by Vasiliki et al. 2016, there was no difference in the children's own perception between the parental presence/absence group except for any increased pain/discomfort found at the second treatment. In another study by Nathan et al. 2015, for preschool children lacking in cooperative potential, and those with a history of fearful or unpleasant previous experiences, arbitrary exclusion of parents from the dental operatory appears increasingly perceived as unproductive and unwarranted. There is also a tendency of parents to prefer to be present for examinations and in many cases for various forms of treatment, particularly for children who are below the age of reason, manifest non-coping and apprehensive behaviors, or have a history of unpleasant previous medical or dental experiences. Also, general belief appears among dentists that parents' presence is not a hindrance to establishment of a favorable child rapport, improved patient cooperation, and office productivity. With that in mind, adult treatment typically entails a one-to-one relationship between the dentist and the patient. However, treating a child typically involves a 1-to-2 relationship among the patient, the dentist, and the patient's parents or other caregivers. This is why it's important to establish a relationship known as the pedodontic treatment triangle. Now, in that, the child is placed at the apex of the triangle, as he or she is the focus of attention for both the dentist as well as the parents. And the parents and dentist are at the base of the triangle. All these three are interrelated, and the arrows denote that the communication is reciprocal. Also, parental attitudes towards advanced behavior management techniques in pediatric dentistry are also crucial, with factors like cost urgency and amount of treatment influencing parental preferences. Given this, the pediatric dentist would need to 1. Communicate effectively. Dentists should explain the procedures and techniques in a way that parents can understand. This includes discussing the benefits and potential risks associated with each technique. Second, provide options. Whenever possible, dentists should provide alternatives and discuss these with the parents. This allows parents to make informed decisions about their child's treatment. Third, consider the cost. Dentists should be transparent about the costs associated with different techniques. This can help parents make decisions that are within their financial needs. Fourth, prioritize the child's comfort and safety. Regardless of the technique used, the child's comfort and safety should always be the top priority. And last but not least, obtain informed consent. Parents or legal guardians provide consent for the dental treatment of their children, especially for younger patients who may not fully understand the treatment being provided.
Community outreach in pediatric dentistry. School-based programs collaborate with schools to provide oral health education, dental screenings, and preventive services to students. This can include fluoride varnish applications and dental sealants programs. Community health fairs participate in or organize community health fairs where children and their families can receive dental checkups, oral hygiene education, and information on available dental services. Oral health workshops conduct workshops and seminars for parents, caregivers, and children on oral hygiene, nutrition, and the importance of regular dental checkups. Collaborate with pediatricians. Work with pediatricians to promote the importance of oral health during well-child visits and encourage referrals to dentists. Preventive programs. Implement preventive programs like fluoride varnish applications, dental sealants, and dietary counseling to reduce the risk of tooth decay in children. Teledentistry services. Offer teledentistry services to reach children who may have limited access to in-person dental care, providing consultations and advice remotely. School dental programs. Oral health education. School integrate oral health education into curriculum. This includes teaching students about proper brushing and flossing techniques, the importance of regular checkups, and the impact of diet on oral health. Dental services. Many school dental programs offer a range of dental services such as cleaning, fluoride treatments, dental sealants, and restorative procedures like fillings and extractions. These services are often provided on-site or through partnerships with local dental clinics. Access to care. School dental programs help ensure that students have access to dental care, regardless of their socioeconomic background. This is crucial for underserved and vulnerable population. Regular checkups. Encourage and facilitate regular dental checkups for students to catch and address oral health issues early. Parental involvement. Encourage parents to take an active role in their child's dental health by educating them about the importance of regular checkups, good oral hygiene practice, and healthy dietary choices. Public awareness campaigns. Importance of early care. Emphasize the importance of early dental care. Educate parents and caregivers about the necessity of a child's first dental visit by age 1 and the benefits of early prevention. Oral hygiene education. Provide clear and practical information on proper oral hygiene for children, including brushing, flossing, and diet. Use simple and engaging materials that parents and children can understand. Prevention of early childhood caries. Raise awareness about early childhood caries, cavities in young children, and the steps parents to take to prevent in this includes avoiding sugary snacks and drinks, and practicing good oral hygiene. Diet and nutrition. Encourage a balanced diet for children, stressing the importance of limiting sugary foods and drinks that contribute to tooth decay. Regular dental checkups. Promote the importance of regular dental checkups for children, even when they have no apparent dental issues. Explain how preventive care can save money and prevent more serious problems later. Target campaigns. Develop campaigns to specific different age groups and their oral health needs, such as campaigns tailored to infants, toddler, school age, and children and teenagers. Volunteer efforts. Dental mission trips. Many dental professionals and organizations organize mission trips to provide dental care to children in underserved areas.
both domestically and internationally. These trips often involve providing free dental checkups, cleanings, and treatments. Community dental clinics. Volunteers can offer their time and expertise at community dental clinics that serve low-income families. This can include performing dental checkups, extractions, fillings, and education on oral hygiene. School-based dental programs. Volunteer dental professionals can collaborate with school to provide oral health education, screenings, and preventive care to students. Fluoride varnish applications and sealants program are often part of these efforts. Non-profit organizations. Many non-profit organizations focus on children's dental health. Volunteers can work with these organizations to organize and participate in dental outreach program and events. Dental education and outreach. Volunteer dental professionals can visit schools, community centers, and daycare facilities to educate children and parents about the importance of oral hygiene and preventive care. Oral health screenings. Participate in dental screenings events at fairs, health expos, or community gatherings to identify children in need of dental care and provide referrals. Donated services. Offer pro bono or significantly discounted dental services to children in need. This can include dental cleanings, fillings, extractions, and restorative work. Dental supplies drives. Organize and participate in drives to collect dental supplies such as toothbrushes, toothpaste, and floss for distribution to children in need. Future trends in pediatric dentistry. Teledentistry, early intervention and education. Telemedicine allows pediatric dentists to educate parents and caregivers about oral hygiene and early intervention strategies, promoting children's oral health from a young age. Remote consultations. Parents can seek advice and consultations with pediatric dentists from the convenience of their homes, reducing the barriers of distance and travel. This is especially useful for addressing concerns about teething, oral injuries, or routine checkups. Digital impressions. Traditional molds are being replaced by digital impressions, making the experience more comfortable for children and providing more precise measurements. Non-invasive caries detection. Devices using techniques like near-infrared imaging can detect early stages of tooth decay without the need of x-rays or drilling. Robotics. Robot-assisted dental procedures are being explored, potentially making dental treatments more precise and reducing discomfort for pediatric patients.
Good evening, everyone. My name is Gabriel G. Obedosa Jr., your interviewer for today. So I would like to, or I am honored to welcome Dr. Hazel Marie Talasunico, also can be called Dr. Peach. She's a distinguished professional in the field of pediatric dentistry. Her educational journey is truly commendable. She completed her Doctor of Dental Medicine from the prestigious University of the Philippines College of Dentistry in 1996, where she also ranked 10th in the dental licensure examinations given by the PRC. She further pursued an externship training program at the Pediatric Dentistry Center, Philippines in 1997. Her quest for knowledge led her to Hong Kong University Faculty of Dentistry, where she earned her master's in dental surgery in pediatric dentistry in 2000. Her dedication and commitment to her profession are evident in her achievements. She is a diplomat of the Philippine Board of Pediatric Dentistry since 2015. Dr. Peach is also an active member of the dental community. She is a fellow of the Philippine Pediatric Dental Society Incorporated and a member of the Philippine Dental Association. In addition to these accomplishments, Dr. Peach has also been involved in numerous activities throughout her illustrious career that have contributed significantly to the field of pediatric dentistry and beyond. She has been practicing at her private clinic, Integrated Oral Health Specialties Incorporated, located at Suite 115 Medical Office Building, Asian Hospital and Medical Center, located at Philinvest Corporate City, Alabang Muntinlupa City. Please join me in extending a warm welcome to Dr. Hazel Tal. So, yes, good
Thanks for the invite. I sound better than you made me sound so good. Thank you.
So, let us now go on with the latest advancements in pediatric dentistry. So, could you share some insights on the latest advancements in pediatric dentistry, such as technology or treatment options that have improved the quality of care for your young patients?
Well, first is parenthesis fluoride, diba? Because it's the cheapest preventative you can give to your patient. You know, toothpaste is actually more effective than your fluoride varnish because if the kids brush 2 or 3 times a day, then their teeth are exposed to fluoride, right? The latest advancements that are, I think, that are more exciting to me is a minimally invasive approach. So we're doing a lot of SDF now. That's your saccharide, your silver fluoride. So we, in a way, cauterize cavity. So we kill off. Silver is used by ENTs to cauterize it. It's chemical cautery. So we kill the bacteria on the tooth, and then no bacteria, no cavity growth. So it turns the teeth really deathly black. Doesn't look nice, but if you're in a hurry to arrest caries, then this is the way to go. And we're also going into Hall technique. For me is exciting. That's using stainless steel crowns for class 2s. Because if you imagine, diba, parang cavities will grow if there's substrate. So with the Hall technique, actually, you don't excavate a cavity anymore. What you do is you keep the substrate from reaching the bacteria. So you cover, it's full coverage, you cover the whole tooth. So whatever bacteria is within the cavity has no nourishment. So they become dormant and the cavity doesn't grow. And you don't need to drill. You can do this in 5 minutes. So it's all good for the kids. And we have the data now that shows that it works. So Hall technique, the use of silver diamine fluoride, these are exciting. Then you have your biomimetic materials, so that's exciting also.
Yes, you heard that right there. Those are a lot of treatments and new technologies that could be applied, especially for the young patients. Can you emphasize the significance of early childhood dental care? What common issues do you frequently encounter in young patients, and how can parents help prevent them?
Well, I think first and foremost, we have to remember that all of us will be dental patients all our life. So your first experience, I believe, with the dentist will carry you through. It's either you love going to the dentist or you're deathly afraid of it, right? So so we need to make sure that the kids will grow up liking dentistry because they will have to see their dentist all their lives. Second, behaviors are learned very early on in life. So I believe, I tell my patients that dentistry is just like taking care of your teeth is just like taking a shower. You can't live without it. So these behaviors have to be taught early on. The way we eat, you learn by age 1 to 2 years old. So people say, kasi sweet tooth yung anak ko eh. But actually, we train the kids to be sweet, to have a sweet tooth. So it's very important to target behaviors and develop good habits earlier on. What's the most common issues that I encounter in young patients? Still cavities. I think the Philippines still has the second highest caries rate in the whole world in primary teeth. So a lot of our time is still devoted to treating carries the disease, not a cavity. And how can we help parents prevent them? It's education. You can only teach and impart to your kids what you know as well. So you want the knowledge base of the parents to be sound, so they can pass the right things on to their kids.
I have one question, but it's not part of the interview. Is the white coat syndrome actually true?
Yeah. Oh, sorry. Yeah. I don't use my white coat in my clinic.
Oh, okay.
Yeah, because your patients go to their pedia, they get vaccinated by so many times by a person in a white coat. So white coat is a no-no for pediatric dentists. So you want a relaxing environment. So the colors of your office have to be subdued. You don't want the music. You have to choose your ambient music well, and you don't wear a white coat. When the kids see the white coat, they get stressed. It's associated with the many vaccinations that they got. And especially if your patient has an underlying medical condition, then they've been to so many doctors and so many tests already, and all of those guys are wearing white. So it just gives you more stress. Although we look good in white coats, di ba?
So yeah, that is my curiosity. It is now fulfilled. So thank you. So, yeah, that's all for the interview. So I just want to thank you again for being part. This will be definitely useful for our reporting for pediatric, because we need expert evidence. So this is a perfect opportunity. So yeah, thank you.